All right. All right. Well, hey, Dr. Phil Hellman, thank you so much for coming on, man. I think I'm really, really excited just to teach everybody about what it is that you're doing in the Rochester Hills community and beyond, Detroit Metro, and your unique practice model. And first, if you don't mind, just tell us a little bit about yourself.
Thanks for having me, Seth. So like Seth was saying, my name's Phil Hellman. I'm an MD with Paradox Health Direct Primary Care here in Rochester Hills. I'm from Troy originally, spent some time out west for training, went to medical school at Michigan State, and like I said, I was out west for a little while, and then eventually moved back to Michigan, where my family and my wife's family is from, and sort of made a home here in Rochester, and have been here since 2017.
Awesome.
And when I came back, I founded Paradox Health Direct Primary Care.
Awesome. Yeah, when I first met you, Phil, it's probably a couple years ago now. I had just heard of direct primary care as this newer model of primary care. I had found it kind of randomly online, to be honest with you, and did a quick search to see if there's anyone local doing this kind of thing. And you popped up literally in Rochester Hills, in the same city that my practice is in. And that's, I still remember our first conversation over coffee and just hearing about what direct primary care is, and just being kind of blown away that existed, and why aren't more people doing that? So what is DPC, or direct primary care? Can you tell us?
Yeah, so it's been around since the late 90s. It's kind of contentious as to who was the first person to start a practice. And I think a bunch of people did it on their own independently without even knowing of the others, but it's really grown in the last couple of years. And mostly because different technologies and medical records and its popularity have made it a little bit more easy to start up. A little bit more scalable, if you will.
Sure.
But what it is it's a membership-based healthcare model. And so my patients pay me a monthly membership fee. It's age-based. So through the adult ages, it goes from $60 a month, $75 a month, up to $85 a month when you hit 65 or Medicare age. Kids are cheaper. I'm a family doc, so I do kids all the way through geriatrics, newborns really. So we call it cradle to grave medicine. So if you've got a family, if you got young adults, you're talking $60 a month for the parents, and then 25 for the first child, 10 for any subsequent. So that's, $120 a year for care for your kids for the whole year. There's no insurance involved. So that's a key differentiator. So I don't ever bill insurance for anything that I do. That's just covered under the monthly membership fee. So that monthly membership fee gets you unlimited visits without any copays. There's no startup fees. And there's no contract. Most of my patients just pay me month to month for that.
Yeah.
So that essentially equates to concierge medicine, which has been around for a long time. Now, most concierge docs are around $2,500 a year. Often that's an upfront, yearly payment. So direct primary care is much more affordable. It takes care of that piece, along with the quality and the access that a concierge physician would provide. My patients have my cell phone number, they have my email, they can contact me whenever they need to and talk to me directly.
Yeah.
The other piece that direct primary care tries to add on is what we call value add services. So for instance, I stock generic medications at my clinic, sell them to my patients at a wholesale price. So they just get that savings passed on. Same with lab work and imaging. It's all cash-based and really affordable. $20 for your physical labs, $40 for an x-ray. So, much like a Costco membership, I make my money on the membership, not on the additional services that I offer to my members.
Anyone who's seen like their explanation of benefits from insurance, by the way, on like an x-ray or those labs that you talked about, like those prices blow people's minds when I tell that to them too. It's crazy.
Yeah, it's pretty insane. As soon as you take the third party payer out of the equation, everything becomes very simple. you offer to pay cash, and people's eyes light up and they say, oh, okay,
Yeah.
well, here's a separate set of prices when you're not using insurance.
Yeah. Right. In full disclosure, I've had my entire family on with you for a while now too, and it's been an amazing experience. That's one of the reasons I want to get this out there to people. But I remember distinctly. I think it was our first meeting when you described this model and you told me the pricing. I remember telling you you should be charging more. And no, I think the thing I remember is really how you responded, which was, you're not, the point is not make as much possible money per month. It's be able to kind of like incentivize yourself to be taking care of your group of people, which, and I'd like you to speak to this too, is much smaller than a normal family medicine doctor, right? There's a normally family medicine docs have really high number of patients annually, and you cap it at what?
So I'm going to cap my practice at 600.
Okay.
And I've got about 300 currently. And
Awesome.
on average, most family medical docs, it's kind of funny. Same number as the cost that I mentioned before for concierge
Yeah.
medicine, which is around 2,400 or 2,500 patients in a panel.
Yeah.
So people always complain about they can't get in for a physical to their doctor. They have no idea how many patients their doctor has, and it's way too many.
Yeah. Yeah. And I'm sure some of them experience burnout much. I mean, really anyone in healthcare that has worked in a really high volume practice of any sort understands that feeling, and myself included.
Yeah.
It's exhausting, and I've even heard the term empathy fatigue, where you're really like you get into medicine, you get into healthcare to help people
Right.
because you care about that and you want to make a difference in people. And sometimes when you're hit with that reality of really high volume and tons of people, it can kind of get exhausting, and you don't offer that same level of care. So I guess that's go ahead. Go ahead.
I was going to say, I think you and I had very similar experience where when we
Yeah.
got out of our training, we worked for, roughly 2 years or so in the system,
Yeah.
in sort of, insurance based medical industrial complex. And we both saw the writing on the wall that, okay, if I'm at a juncture, what am I going to do for the next 20 years of my life?
Yeah.
Well, it ain't this.
Yeah. That's right. That's right.
I could take 2 years, but another 20, I'm going to burn out,
Yeah. Yeah.
maybe we weren't quite burned out, but, there's something to be said for planning ahead.
That's exactly right. I feel like that leads in pretty well to, and I know you probably answered this already, but why is it that you decided to come to Rochester Hills and set up a DPC practice as opposed to probably your many other options?
So I've always been interested in areas of medicine that I thought were sort of underserved. So I thought there were, particular areas where there weren't doctors spreading what I thought was the truth about, a certain issue. And so that's always been on my heart. And I've always known that I've wanted to kind of have my own practice, because anytime you're working in a group or for a hospital, for instance, it's tough to stray away from the mainstream sort of
Yeah.
3x5 index card of mainstream medicine. And I definitely had some alternative views on a few matters. So I knew I wanted to start my own practice, but I didn't know what that looked like. And coming from the practice I was at in Oregon to Michigan, I didn't have a job. Um, like you said, I thought about joining a group practice just to pay off more debt, earn good money. But I had some conversations with some people. I had a conversation with a guy that I worked with in Oregon who did a DPC practice in the town while I was there. He said, don't think twice, just do it. It's the best decision I ever made. Had another conversation with Paul Thomas down in Detroit at Plum Health, and he said, why wait? And so I thought, now's the time. And the other thing I was noticing was a trend of people not just complaining about their healthcare, but actively seeking for an alternative. So I thought, okay, the demand's there, the time is right. I'd rather not join another practice and quit in 2 years. That's really tough to do on patients. And so that, stars kind of aligned.
Yeah, I would imagine. That's interesting. I think we've given a lot of information about like what this is, why you've done it. What I think would be really interesting for people to hear, and I'll give my brief perspective on it too, is what does it practically look like? Like, how is the practice actually different? And I think honestly, therein lies the largest benefits to people that are at all interested in this kind of thing, which is that every appointment I or my family has had has been extremely fast to schedule, as in text or do a little teleconference if we need right away, all the way to like, hey, you want to come in this afternoon? You want to come in tomorrow? And there has never, I don't think there's ever been a time constraint on any of our appointments. So we can chat through and take a deep dive on literally anything that is important to me as the patient. And that is like, to me, and this is the biggest complaint that I hear from patients as well, which is a 5-minute appointment where we don't really get to the root cause of anything, or do the right testing or get any other insight, right?
Yeah.
And that's not necessarily a dig on other people, because I understand the demand of high volume practices and the struggles that these people are working with. But I've been really compelled at how differently it has been with you as my doctor, because of those reasons. So like, what, in addition to that, like what does a visit look like with you? Do you set time constraints on any of this stuff? Like what are the specific advantages to working with you?
Yeah, I think, Seth, you really hit it. That's kind of where the rubber meets the road. And this is where people really see the value, is when they actually
Yeah.
come in and they talk to me. As a physician, if you go into medicine and you don't like to talk to people, I think you should pick a different career.
Yeah.
Uh, I like to talk to my patients, and honestly, sometimes I get in trouble where we're 45 minutes into an appointment and we haven't even started talking about their lab work or their issue that they're there for, because we
Yeah.
just get off on a tangent.
Right.
But I tend to schedule large blocks of time for my appointments. I don't often have a lot of appointments in a day. So if somebody comes in, I like to get everything taken care of and get it out of the way, because I'd rather them come in for an hour, get all their needs handled, have them, very satisfied with their appointment, rather than, hey, you've only got 5 minutes with me, and you need anything else taken care of, you've got to make another appointment. It's not in my interest to do that.
Yeah.
Because I don't get paid every time they come in.
A very interesting detail, by the way, right there.
Yeah, I get paid the monthly fee regardless of how many times they come in.
Yeah.
So my incentive is to keep my patients, both happy in terms of the amount of time that they're able to spend with me, and also healthy, so that they're not constantly calling me for their ailments and illnesses.
Yeah.
So I think, it really aligns a set incentives. The model does, where, the amount of time that I want to spend with my patients and the amount of time that they want to spend with me really lines up well.
No doubt about it.
But yeah, I mean, often, I schedule an hour for physicals, half hour for any other appointment, so that we have plenty of margin worked in and people aren't rushed out of the office.
Yeah. So, I just think, wrapping up, there are many of the people watching this are going through the open enrollment process for their insurance, or they have already completed and gone through that process. And one of the main reasons to put this out now is just that they see the other options that are out there. So with that in mind, how can people get a hold of you, learn more about your practice, or reach out? I'm sure you have like an easy contact form or something.
Yeah, you can go to my website, which is just www.paradox.health. All my contact info is on there. The phone number on there is
That's
my
right.
cell
Just
phone.
screen shared. I just screen shared that exact website right there.
That was amazing. So yeah, that's all on there. There's a little contact form at the bottom that you can send in. So lots of ways to contact me. Address is on there. I'm on Twitter and all the socials at usually just paradox_health. Post a little bit on Instagram. And like Seth said, you can use your HSA to pay for your membership. It's less than your cell phone bill. And, I pretty much accept all forms of payment except
I think you offer an awesome service. I can vouch for it personally, and patients that I have sent your way rave about the experience. So really happy that you're doing this in Rochester Hills. happy with where your business is going and what you're doing for this community. And I'm glad that people have a way to contact you and learn more if they're interested.
Thank you, Seth. And I appreciate you being there. You're obviously one of my easiest referrals. So
Awesome.
keep doing the good work you're doing.
Will do. Will do. Thanks, Phil.
All right. Thanks, Seth. Bye.
Hey, Seth King here, owner of Limitless Physical Therapy and Performance. I hope that was a valuable video for you to watch. Now, I know it's 15 minutes long. We take a deep dive on what his practice is like, but Phil is doing some really, really great things here in Detroit Metro, providing affordable, extremely high-quality healthcare for individuals in our area. So just wanted to make sure that I highlighted him. We'll potentially highlight some other individuals in Detroit Metro that are also doing some innovative things. So please tune in. If this was valuable, please drop it a like, leave me a comment, and please subscribe to this channel. There's going to be a lot of stuff coming your way in 2020 for the rest of the month here, and also for 2021. Lots of stuff coming. Hope you have an awesome day. Thanks a lot.